that you were really got some great information and you feel fired up and ready to go out and serve our community on COVID-19 from the discussion you had in the main panel. This is the Contra Costa County COVID-19 Black panel, and we have a really great group of speakers that we have today where you can get your questions asked and answered, and you can find out more about how we can come together as a community to combat COVID-19. So my name is Michelle Milam. I am your moderator for today. And I'm your facilitator. So welcome. You can pull up a chair, put your coats on the bed. This is like your virtual living room. We want everybody to feel at home. Just a few housekeeping things before we get started. The first is that if you have questions, the way we're going to do question and answer in this panel is we're going to drop it in the chat. I know that they have the Q&A feature, but we just ask everybody to drop it in the chat. Yes, this is Contra Costa. So if you're in if you need to go to another room, this is Contra Costa. And the other thing is that we will have question and answer after the panelists have done their presentation. So we'll have plenty of time for that. I'll give you guys a time check. And then when it's time for us to adjourn, I'm going to drop a link in the chat that will help you return back to the main room. So if you need to get back to the main room to finish the wrap up, you'll have an opportunity to do that. So to get ourselves started, I'm going to first introduce our first panelist, and she will introduce our two main speakers, and they'll be able to tell you a little bit about themselves and go into their presentations. So I would like to introduce Shannan from Health Services. She's a Health Service Administrator at Contra Costa County Health Services, and she is going to give us an overview of some resources that might be helpful for our community. So I'm going to turn it over to Shannan.
Great, thank you, Milan, and thank you all for joining us this evening. I'm sorry, I'm calling you Milan. It's Michelle. Thank you so much for joining us this evening, and we're really excited to share some information about our administration of the vaccine in Contra Costa County. And also, I am really excited to turn it over to our esteemed medical professionals, both Dr. Desmond Carson and Dr. Napoleon Dargan. So if we could have the first slide, please. So this first slide represents a moment in time of the vaccine administration in Contra Costa County. African Americans make up about 10% of the overall population, and according to the last census, the majority of African Americans reside in East and West County. Most of the cities in East and West County had a high number of positive COVID-19 cases, and yet in early March, only 3% of our African American residents received at least one dose of the vaccine. As of March 11th, 4.7% have started the vaccination process, and to date, there are 62,720 African American residents who need to begin the vaccination process. Next slide, please. So we acknowledge the mistrust and the numerous questions our residents have about the vaccine. The goal of our Chief Equity Officer and our Outreach and Engagement Unit is to reduce barriers and increase access for our community. Our African American COVID-19 work group created a video series that can be viewed via the Contra Costa Health Services website and the YouTube channel. This series features one young adult male, one female medical professional, and one male pastor and medical professional who conversed with our facilitator, Michelle Milam, about their experience with COVID-19, how they keep themselves and their community safe, and how they keep informed about the vaccines that are available. The goal of the series is to present real dialogue from people who look like us and may have the same concerns as we do, and provide a platform for further discussion amongst our family members and our friends. We also rely on our partnerships with community-based organizations such as Lifelong Medical and La Clinica that have successfully built trust in their respective communities and provide vaccine to the hardest hit areas of our county. Another example of our outreach efforts is with John Muir Health's mobile clinics and faith leaders from One Accord Project to provide vaccines at local church sites. There will be 2 events in West Contra Costa County, one this Saturday at Sojourner Truth Presbyterian Church, and an event next Tuesday at Bethlehem Missionary Baptist Church. There's a registration link, which I will share with you in the chat, for each event that will close when all the slots are full or by 12 p.m. the day prior to the vaccine or to the vaccine clinic. Next slide, please. So we have a website for more information about how to access the appointment scheduling to schedule a time to take the vaccine, as well as informational materials that are designed for African-American community members. So please visit our website for more information. And now I would like to turn it over to our esteemed medical professionals, Dr. Napoleon Dargan and Dr. Desmond Carson.
Napoleon, you want to go ahead?
Next slide, please. Dr. Dargan, you can go ahead, and then Dr. Carson.
Unmute yourself, cuz.
Hey, thank you, Doc. Thank you. Super excited to be here. Mental health professional. Definitely have been seeing the impacts of COVID-19 in the district, and not only in the mental but financial means. So excited to be here with the brothers and sisters, because this is also just, again, something that I feel like is lacking in the culture. Let's go to the next slide. Oh, okay, so that's it. So I wanted to actually create some space to ask, like, what are your thoughts? I mean, we talk about the healthcare disparities, and that, like, hey, we only represent so much of the population, yet we're being impacted by this in such a disproportionate way. Just kind of wanting to know, like, what are your thoughts, or did you guys have any questions? I seen one question that came up in the QA. Doc, I see here someone says, good afternoon. I'm curious to know if there's any data on the vaccine and pregnancy at any stage, and also how do we ease an expectant woman's mind around vaccination?
Is it time for me to chime in?
Yeah, Doc, I'm throwing that to you. What you think?
Yeah, either of you
Okay,
can answer.
baby. So, just briefly, who I am. I'm Desmond Carson. I've been practicing medicine in Richmond for the last 25 years. I was born and raised in Richmond, born over there by Crescent Park, went to Portland, went to El Cerrito, Cal Medical School, now I'm back home. So I haven't practiced, emergency medicine for 25 years. In this new pandemic, I can just tell you the observations that I've made, and I'll give comment to your question about females. One, I just wanted to let you guys know, of the 740 people that died over the last year, unfortunately, if you look at the spaces at Richmond, Antioch, also Pittsburgh, and if you notice, those happen to be spots where we are highly disproportionately represented, and that's why, unfortunately, we have died in these with this pandemic. As we have went through last year and started this vaccine process, I know plenty of y'all are scared to get this vaccine, and that's something I wanted to talk about. Our anxiety about being first in line for any medicine is well deserved. Historically, Black folks have been disproportionately treated after the Nuremberg Code, which was the standard that said that even the boys in Tuskegee was supposed to get that penicillin when they did the Tuskegee experiment. I understand all of that, but this ain't that, y'all. For those who are listening, since we are disproportionately affected by this virus and we are dying disproportionately, then we should also be disproportionately receiving the vaccine. So one, I would encourage everybody to sign up and line up. As per the anxiety of getting it, I was anxious to get the vaccine myself. So I looked at the data the way we do when we were in medical school. And probably the best resource is the New England Journal of Medicine that has been quoted. And they quoted the study from the Pfizer vaccine on December 15th. So to ease my anxiety of getting this vaccine, because I'm diabetic, hypertensive Black man, I was like, I don't know about all that. I read the literature. The literature is what allowed me to feel comfortable about going to get the vaccine. So of the 2 mRNA vaccines, the Moderna as well as the Pfizer, we received the Moderna, where you get 2, 1 dose and then the 2nd dose later. The new vaccine that came out, Johnson & Johnson, is a 1-dose vaccine. I had very little response. The first vaccine, I just a little sore in the shoulder. And then the second day, the day before the Super Bowl, I was a little tired when I got the 2nd vaccine. Otherwise, no ill effects. As per your question, per females, there is no data right now, but the American College of Obstetrics and Gynecology, ACOG, has said that it was safe for women, but I have not seen that data, and I've been looking for it. CDC has not putting it out.
And I want to just piggyback on that, and thank you, Desmond, because sometimes as a mental health specialist, I really feel like the stress is validated, and at the same time, when I look at the data, I was screaming this morning, and it said that the symptoms was a sore at the site of injection, mild fever, muscle ache, tired, headache. I was like, oh man, that kind of reminded me of like light depression symptoms in some way. And sometimes I feel like sometimes because of what we're going through, I think that can make it harder for us to, I feel like, I don't know, I just feel like those symptoms are like nothing in real time, because people, I feel like we can be numb. Like, I don't know, when I read that, I was like, wow. Like, I feel like sometimes there's so much misinformation too on like the impacts of receiving the vaccine. And I think that is often what keeps us from engaging services too. So I'm definitely grateful just hearing Desmond's voice talk about it in real time, because even I have this information and I'm still, even though I'm fully vaccinated at this time, I'm like, yo, like it definitely made me a little skeptical, like reading even those symptoms, you know what I mean? So I thank you just for speaking, Desmond, because like I said, just hearing that, even though I've been vaccinated, it's like, okay, yeah, man, it's not that bad.
Surely.
Thank you to both of you on that. So I'm going to try to answer some of these questions in the chat.